And well, first of all, for those of you that don't know, my name is Claire Luz, and I'm on faculty at Michigan State University in the College of Osteopathic Medicine, gerontologist, researcher, and executive director of IMPART Alliance. So, IMPART Alliance is sponsoring these lunch and learn sessions as part of our relatively new, newly formed employer-led collaborative, which I can talk about in just a second. Um, in the essence of time here, because we have two really good speakers, instead of going around and doing introductions, if everybody could just put your name and affiliation in the chat box, that would be great. And if it's okay with everybody, we would like to record this so that we can have it available for other people. We'll post it on our website for the people that cannot join us today. And I'll give it just a couple more minutes and a couple more announcements before I turn it over to the speakers. So, as I said, this Lunch and Learn series is sponsored by the newly formed Michigan Employer-Led Collaborative, which has been established to give direct care worker employers a much stronger say in some of the key talks and initiatives that are happening at the state level on behalf of expanding and strengthening the direct care workforce and addressing the shortage. And also for employers just to have access to more information and resources and opportunities and each other to be networking and just strengthen numbers. We're hoping to build an employer network across the state of Michigan. So our next meeting is January 22nd at 9 a.m. It's the first or the third Thursday, I believe, of every month from 9 to 10:30. So please plan on joining us if your name isn't on our mailing list. Chanel, who is our assistant, is going to be adding names to our membership directory, and you'll get a notice about the next meeting, which is the 22nd. One of the things that the ELC has asked to do, and we've just started planning, is to hold a statewide direct care worker employer summit in person. And we are inviting everybody to join. We're just starting the planning. It'll probably happen or late February, early March. And it will be in person, but we'll have some sort of remote option. And it's going to be a great affair with speakers and good food. And we're working with MPHI to help plan that. And some of the people on this call have actually volunteered to help plan it. And we're going to be in touch any day now to get moving on that. And I think I will just now turn it over to our speakers because I know you both have full presentations and I don't want to lose any time here. So let me introduce our two speakers. And one is Jan Karazin. Thank you, Jan. Hope I pronounced that right. Who is the Workforce Program Manager for the Workforce Intelligence Network. And as I just mentioned earlier, has been spearheading and being a champion for registered apprenticeships for years and years. So she knows all about them inside and out. Our second speaker is Jim Willis, who's Executive Vice President and Chief Operating Officer for Gesher Human Services. Jim's going to provide a description of their direct support professional apprenticeship program. So I look forward to learning more about how you implemented it with Gesher. So I'm not sure who's going first. I think it's Jan. So I will turn it over to Jan to take it from here. Thanks, Jan.
Thank you. Well, Happy New Year, everybody. And thank you to Claire for inviting me to share a few thoughts on registered apprenticeship today. I'll start by saying this. I am a big advocate for registered apprenticeship in healthcare. And I could easily spend the rest of the morning or the rest of the afternoon talking about it, but I promise I won't. My goal today is much simpler. I really want to spark your curiosity and leave you thinking about how registered apprenticeship might be a strategy that you can leverage to attract and retain direct care workers in your organization. So, Chanel, I believe you were going to run my PowerPoint presentation. Is that right? Do you have my slides?
I do have your slides and I am looking to do that right now.
Okay. All right. Well, on the first slide, when Chanel gets that up, there is a QR code. So that if you scan that QR code, you'll have my digital, my business card. So to be able to reach out to me afterwards if you'd like to. So I'm going to just go on to slide 2. I only have 4 slides and I'm really talking about the second slide. So short presentation today and designed that way so that Jim has plenty of time and there's also time for questions if you'd like. So on slide 2, why should healthcare employers consider a registered apprenticeship? Well, for decades, it's a proven attraction and retention strategy in the skilled trades and manufacturing industries. We've all heard of registered apprenticeship, but we hear about it for electrician or pipe fitters or those kinds of occupations. So it really is um, a curiosity within the healthcare industry. Um, all these years, healthcare has been sitting on the sidelines, but about 10 to 12 years ago, the federal government put out some incentives in the form of grants to develop registered apprenticeships in what they refer to as non-traditional occupations, which is pretty much everything except skilled trades and manufacturing. And so at that time, there were some organizations that wanted to develop some healthcare apprenticeships. And so they began experimenting with programs mainly in entry-level roles like medical assistants and certified nurse aides. And they had success in that. Um, Actually, there is not an occupation titled direct care worker in the US DOL inventory of occupations, but there is one that is titled home health aide. And when you look at what a home health aide does and what a direct care worker does, they mirror each other. So an apprenticeship could be established today using that home health care occupation to develop a direct care worker registered apprenticeship. But what's really exciting is what's been happening more recently. In just the past few years, more advanced healthcare occupations have entered the apprenticeship space. So we're starting to see programs for registered nurses, radiologic technologists, surgical technologists, and other roles that require degrees. That's a major shift in the world of registered apprenticeship, and it's a huge opportunity for employers to create career pathways from those entry-level occupations, such as direct care workers, into LPNs, RNs, or into radiologic technologists, or whatever the need may be. So it's very exciting as to what we're seeing happen in registered apprenticeship in healthcare. Another really compelling reason for employers to consider registered apprenticeship is the return on investment. The data shows that there is a median return on investment of 44%. So, in practical terms, that means for every dollar an employer invests in a registered apprenticeship, they get about $1.44 back. ROI is one of the most studied aspects of apprenticeship, and the findings are remarkably consistent. It's been 44% for quite a while now. So, what does that return actually look like day to day? And I'm sure Jim can speak to that. But based on the data, Employers report that there's higher productivity, better quality of work, and stronger employee retention. Why is that? Because an apprenticeship creates a shared investment. The apprentice is committing to the organization, and the organization is committing to the apprentice. There's long-term expectation on both sides, which builds trust, loyalty, and motivation. Both sides are invested in the success of this apprentice. So when people feel invested in and supported by their employer, the results tend to follow. And I hear that this comes from data from several studies that have been done, but I hear that from the employers that I work with through the my organization's employer-led collaborative. One of the biggest motivations that I hear from employers is an opportunity to advance their existing workforce. Many organizations are creating apprenticeship pathways that allow nurse aides and medical assistant, food service workers, etc., to move into roles like LPN or RN. Employers already know these employees are strong performers with the capacity to grow, but the challenge is that many of these employees can't afford to leave their full-time wages and benefits to attend a traditional college program. So a registered apprenticeship bridges that gap by combining paid work and structured learning, making the advancement possible without stepping away from that paycheck. The employer-led collaborative, the Health Careers Alliance that I convene, they recently wanted to do an apprenticeship. Multiple employers do a registered apprenticeship in LPN. This was mostly, not all, but mostly long-term care facilities who wanted to advance their certified nurse aides into LPN roles. And so these employers from throughout the state came together and realized that there wasn't a lot of training programs anymore for LPN. There's reasons for that, but I won't go into those details. So they worked with nursing educators from, again, community colleges across the state, and they developed a training program that is built specifically for these employers or any employer that wants to advance incumbent workforce into the LPN role. In fact, they worked with the State Board of Nursing, and so an LPN apprentice at an employer's organization does the entire nurse LPN training program online, facilitated by the faculty, and even the lab is online through virtual reality simulation. And again, the State Board of Nursing was involved to approve that. So that is something new, and that program is up and running. It started about a year and a half ago. It's had its first cohort of graduates of CNAs advancing to LPN, and it has its second cohort enrolled. And these employers worked with the educators to build the program so that those LPNs now are well positioned that when and if they and their employer would like to see them advance to RN, they have a lot of those classes and requirements for RN already done. So it really was neat to watch, and I think something that could be considered as a best practice. My organization holds the standards for that, but so do a lot of organizations. So, and I'll talk a little bit more about that, but that is something that any employer could sign on to. And it's built also so that it doesn't have to be just certified nurse aides that advance. It could be patient transporters. It could be food service workers. It could be a variety of entry level occupations of people that have worked for an organization but want to advance. And so it's built to help those people get that advancement into LPN as well. Let's see. Oh, career changers. That's another one. Registered apprenticeship is a great way for employers to tap into a population that is untapped, and that is the working adults. Some working adults are working in jobs and hold college degrees or prior credentials. Some are working in jobs that utilize their college degree and their credential, and some are not. But they too often find themselves in jobs um, that they don't feel they can leave because of leaving wages and benefits to move into a healthcare career. But they're out there. I've seen firsthand. I used to be a program director and faculty of a radiologic technology program at a community college. And one of my students was a mechanical engineer. He had a master's degree. He'd been working for over a decade as a mechanical engineer for a company out of Grand Rapids, and he um, completed the radiologic technologist program. He said it was a huge decision. It took him 5 years to actually pull the trigger because, again, that was back before apprenticeship in healthcare. And so he was going to have to quit his full-time mechanical engineering job to undertake the radiologic technology program. And so he had to really contemplate over that and make some plans, but he finally did that and completed the program. And he was called to do this, as he put it, called to do this because he'd spent time with his father who had undergone cancer. So he was in the hospital a lot of times and said he felt a calling to enter the healthcare industry. And so, but it took him 5 years to get there because there was no clear supportive pathway like registered apprenticeship that would have helped him do that sooner. I also know of teachers who've transitioned into healthcare occupation, one specifically into dental hygiene. I know of a school office clerk. She had worked in various clerk type positions, all of them grant funded. And of course, when the grant ran out, she had to regroup and find another position, and that became tiresome. So she really thought about what is it I really want to do with the rest of my working years? And healthcare was it. And so she trained to be a certified nurse aide and went into a long-term care facility and was very happy there. So these people are out there, and apprenticeship really helps them make that leap from working to pursuing a new career. So why now should employers be considering registered apprenticeship? Well, there's not have never been more support for registered apprenticeship than there is right now. The federal and state government is investing heavily, especially in non-traditional occupations like healthcare. And that support comes in two forms. One is funding, and the other is expertise. So, funding, there is funding available for employers and for apprentices, but there's also wraparound services for your apprentices, etc. So, partners like your regional Michigan Works agencies can really help answer questions and guide you through setting up an apprenticeship and even helping to manage it. Um, that's called intermediary, and they are an intermediary between you and the Department of Labor. And they, like I said, walk you through it. That's part of what I do with employers is helping them set their apprenticeship up and identify their training program and look at their long-term goals. Do they want this to be part of a career pathway? On and on. And then I have a colleague that actually manages the apprenticeship once it's approved and running. But yeah, your Michigan Works agencies are very well informed. Also, federal and state funding are usually sent to the Michigan Works Agency. So in order for you to tap into that funding for you and your apprentices, you need to partner heavily with your regional Michigan Works Agency. So I hope that what I've told you so far has kind of met my goal today of leaving you wanting more to learn about with registered apprenticeship. And to help with that, I did prepare an FAQ document for Claire and Chanel to share with you. And then on the next slide, I have the next steps where you'll see, if you want more information besides the FAQ document, you can reach out to me directly. My email is right there, or your regional Michigan Works office, specifically the intermediary group sponsor for registered apprenticeship. And I've given you two different links that will link you to a list of the different group sponsors or intermediaries at the Michigan Works Agency. So you can find what county you're in or know what county you're in, and then find your specific person from your Michigan Works Agency to connect with to learn more about registered apprenticeship, how it can serve you, and then help set it up and run it for you with the DOL. So lastly, I have included, next slide, Chanel. I've included the list of references. I referred to some data and some studies and that kind of thing. And these are the data sources and studies that I was referencing. They also might be helpful to you if you want to look some of these up and read more about registered apprenticeship. There's a lot of testimonials in some of these articles from apprentices as well as from employers. And so you might find those interesting. So if Chanel and Claire make sure that you all get the FAQ document, again, feel free to reach out to me to help you. What I can do is connect with those Michigan Works agencies on your behalf, or if you just want to ask some general questions, I can help with that as well. So thank you. I appreciate the time today.
Thank you, Jan. That was great. And that must have been hard for you to put, I know, hours and hours crammed into just a few minutes. Do you want to take a couple questions now and then turn it over to Jim, or shall we wait on questions until the very end for both of you?
Why don't we let James go? I want him to have plenty of time for his presentation. My understanding, James is an employer, so he's the one the employers really want to hear from. So let's move on to James, and then if there's
Okay.
time, we can take questions.
Sure, absolutely. If we run out of time, I do want to let the group know that one of the things we are hoping to do is to identify a couple of employers or a group of employers who want to do this and help facilitate that process, by maybe contacting Jan at WIN, for example. So keep in mind, if this is something you aren't doing already and you would like to do it, we would love to be able to facilitate that for you. So maybe at our next business meeting, we can talk more about this too. So we'll turn it over to Jim right now and hear his presentation, and then hopefully have a few minutes at the end for questions.
Great. Thank you, Claire. I have a few slides I'm going to share directly, so I think Chanel may have to unshare before I can share mine here. There we go. Oh, I'm sending a request, I guess. All right. Has it been approved yet? Let's try it again.
Yes.
Yeah, it should be.
Let's try it one more time. Okay, there we go. Everybody see the screen okay?
Yes.
Yes.
Excellent. So before I kind of jump into sort of how Gesher operationalized our apprenticeship program, I thought it might be valuable just to talk just a little bit about how apprenticeships, how we've integrated them into kind of our larger organization. So Gesher Human Services, fairly large nonprofit in Southeast Michigan. I think we employ around 504 employees across Macomb, Oakland, Wayne, and St. Clair counties, and predominantly provide services for folks in workforce, residential settings, and then a variety of kind of community settings. And we have leveraged, and I think right now we employ just over 120 direct support professionals. And for my presentation today, I'll use DSPs or direct support professionals, DCWs. I'll kind of use that terminology sort of interchangeably. We kind of ebb and flow based on the funding source and the organizations that we're kind of working with. But kind of across our continuum of services, we currently leverage the apprenticeship program for our senior programming, our community living supports, our community-based residential programming, and we also operate a community-based skill building and supported employment program. And we have apprentices in all 5 of those settings. So when we launched our direct support professional program here just less than 2 years ago, we had to identify which DOL OC title we're going to kind of build our program off of. And the closest one that we could find for that fit the work that we would be doing was the direct support specialist job title. You see the ONET score in there, and then there's a specific apprenticeship code that we were awarded once our standards were approved. And I'll talk now a little bit about kind of what that process looked like. Nope. Before that, I'll talk a little bit about why we decided to kind of go down this road. So I would say one of the benefits that we didn't realize when we kind of launched this initiative is that it actually created a pathway for many of our existing staff here at the agency that didn't have the experience or the educational background to move into one of our direct support professionals. It gave them a pathway to kind of move into those positions. We were really more thinking about this initially for new candidates. You know, a number of candidates were applying for our DSP roles in all of our settings. And we, at that point, had a requirement that people had at least 2 years of experience with that population prior to being eligible for those positions. So we were having to turn away a lot of people that really fit with our agency values of people first and integrity and kindness. And these individuals fit, and they were saying all the right things during our interviews. But because we had sort of this foundation requirement around work experience, we didn't really have an on-ramp for these individuals to move into roles. And the apprenticeship program initially was sort of that foundation. But as we started to launch, we noticed that it also created a pathway, and I think Janice referred to this as well, for many of our existing staff as well, to give them an on-ramp to additional opportunities within the organization. And then there was a couple of other, so I would refer to as kind of value adds that, again, we didn't realize when we, were looking at the value of this. But once we actually launched, we saw that it really standardized our onboarding process and training for all of our DSPs, whether or not DSPs were coming on for our apprenticeship program or they were coming on as direct support professionals. It really forced us to kind of standardize that onboarding and kind of training process, which has helped all of our programming. Certainly provided some additional improvements around just kind of general compliance and with some of our auditing bodies. The standardization around the training and onboarding provided some support there. And I'll talk a little bit more about some of the grant funds that became available to us as a part of the apprenticeship program as well. So this is kind of how we launched and the steps that we took to launch our apprenticeship program, which took us, I think it's moving a little bit quicker now. It was a little bit more challenging for us initially just because we were launching at a time that there weren't a whole lot of direct support professional apprenticeships in Michigan. Now there's a number of them, and WIN has been instrumental in helping us to kind of move from the place of kind of the planning to the place of where we're at today. So the first step for us was, just like Janice said, was to partner up with our local Michigan Works office. At that time, they also connected us with WIN, who also assisted us through the next couple of steps. So first step was for us to establish our work competencies. And these are the skills that we felt were necessary for somebody to be a fully credentialed direct support professional. So we looked at job descriptions, we looked at some of the competencies that were outlined in the Department of Labor's direct support specialist job title, and some of the kind of details in there, and integrated all of those into a set of work competencies that really fit not only for the DOL, but also fit for the work that we were doing in each of our work settings. And then we had to identify classes, and you'll see on the next slide here, we have a sort of blended approach to our classes. So we have a number of in-house classes that we offer through sort of our online management system. We have some classes that we pay for on behalf of participants that are virtual and that are on demand, so they can do them kind of at their own time. And then we were strongly encouraged by our Michigan Works partners to at least have 1 or 2 community college classes integrated into our standards. And the reason for that was they provided us some guidance that integrating at least 1 or 2 community college classes into those standards would help us with some of the grants through the Going Pro Talent Fund and state apprenticeship programs. Certainly not a requirement, but we have found that the investment in those community college classes has really helped us on the back end with some of the grants that we've applied for as well. So once we had the competencies, we had the classes identified, we then brought all of that together. And again, this was with lots and lots of support from our partners over at WIN. We applied to the Department of Labor for approval of our apprenticeship program. Specifically, it's referred to as the Appendix A that you'll be completing that identifies all of those competencies in those classes. I will say that our first application was not approved. They were looking for, the DOL was looking for a little bit more content on our class side. They felt that we hadn't quite met all of the requirements that they were looking for on the class side of the house. So we did add a couple of additional classes. We swapped one out and added a couple additional ones in there based on that guidance. And then our second application was quickly approved after that. And then the next process was for us to start to register apprentices. And we did this a couple of different ways. We spoke with our incumbent staff here at Gesher to start to identify staff that potentially would start working on their apprenticeship program while in their current roles, and then did a pretty comprehensive outreach and kind of marketing campaign kind of in the community. Started putting onto our website, in addition to our DSP roles, but added the additional apprenticeship opportunities as well there. And then even did a little bit of outreach to our local news and PR firms kind of locally here to just kind of get the word out that for individuals that are interested in this work but don't have the kind of educational background or the sort of financial position to be able to go to training for 6 months without getting income, that this is a great way to get paid while you're training. So that initial kind of push garnered us. I think we launched initially with seven apprentices that we onboarded in the first 6 months. At this point now, we have 22 apprentices that are currently enrolled, and then that first group of 7 have completed. And I'll talk a little bit more in a few minutes about the roles of those 7 completers. Once we registered the apprentices, initially, because we didn't have journeymen or people that had completed the apprenticeship program, we had to identify a couple of staff here in the agency that would track and what I kind of refer to as sign off on those on the competencies. So we identified a couple of our case managers attached to each of those programs that were really responsible for meeting at least hourly for an hour each week with each of our apprentices to talk a little bit about the competencies that they were working on for that week, what work that they have done kind of related to achieving that competency. And then they also engage those apprentices on the status of their classroom activities as well. And then obviously the final stage is once they completed all of their competencies kind of on the skill side of the house, and then all of their classes on the classes side of the house, we were able to issue that credential. So for us, this is just a kind of a quick overview on our competencies. There's a number of skills that sit under each of these categories, but everything from orientation to the work environment, technical knowledge. We have a section in there around ethics and integrity. A space in there around wellness, and then also a category around teaching and supporting. Again, there's probably 7 to 9 competencies that sit under each of these competencies that our staff is looking at weekly to see that they're making progress toward the ultimate credential. And then the slide that you're looking at here now is our breakdown of classes. So we have 3 different categories that the direct support professional apprentices are working on. Obviously, the community college class they take, we do ask that they complete at least 75% of their Relias and their Ed2Go trainings prior to taking that community college class. The community college class has I would say a bit more of a substantial kind of financial commitment from us at the agency. So we want to make sure that they're committed and are making progress toward their other classes before we kind of launch them into that community college class. So we use Relias. It's a learning management system. And under Relias, our learning management system, a number of those 9 classes that you're seeing there are required classes for those positions. Not all of them, but some, many of them are required classes. So we're able to bake some of the required classes from our funders right into the kind of classroom continuum, as well as some additional classes that we have kind of in our Relias system that we thought would be really, really valuable in kind of rounding out their training. We felt like we needed a little bit more than what was offered by Relias, so we contract with one other organization for training. The organization is called Ed2Go. Ed2Go is online kind of virtual organization providing training. It is all on demand, so our staff, our apprentices that are working on these can work on in the afternoon and evenings. One of the biggest questions that we have, and I often get about, so when do staff have time to work on this if they're also working while they're in the training program? So the way that we've gone about it, and it's worked out quite nicely, is our direct support professionals have a general work week of 35 hours a week. That's considered full time. Then what we do is we give them up to 5 additional hours every week to work on their training. So they can take an additional 5 hours at the end of the week. They just have to kind of document to their supervisor what trainings and what progress they've made. And they can book an additional 5 hours weekly toward their classroom component, which allows us to kind of maintain costs. We know that the maximum is going to be that 40 hours, also giving them the kind of opportunity to work on these classes without us having to not schedule them to be working alongside of participants and not being in kind of a billable setting for their kind of general workday. So just a quick breakdown kind of on the classes for us. So the Ed2Go platform, those classes cost us about $50 per class. Community college class ends up being around $300 plus or minus a little bit, kind of on the cost side of things. But then there's a good amount of funding out there available to really offset those costs for those classes. So we've been awarded the last 2 years in a row funding through the Going Pro Talent Fund. Certainly work really, really closely with your Michigan Works office to apply for those funds. We've also applied for and received the last 2 years the SAE grant, or the State Apprenticeship Expansion Program grant. Again, that has really, really helped us tremendously to offset some of those additional class costs. There's also some local workforce board grants that are available, a little bit smaller kind of in nature, but certainly help to kind of offset some of those classes. And then additionally, and this becomes a support more for the apprenticeship and not as much for the organization, but we've been able to tap into some WIOA adult and dislocated worker funds and supportive services for our apprentices. So almost all of our apprentices have received a laptop as a part of their apprenticeship program. They needed a laptop in order to kind of work on the trainings. They've also received some supportive services through the Michigan Works office for transportation to get to and from their classes, and some additional funding for uniforms and that kind of thing kind of initially. So make sure that when you're engaging your Michigan Works representative, that you're talking not only about funding for the organization to kind of stand up your apprenticeship program, but also some of the supportive services that can support your apprentices while they're participating. And I am happy to share this PowerPoint and add kind of any, provide any kind of additional kind of guidance as you're kind of going through the process. So my contact information is right up there on the screen. I will throw it into the chat here in just a moment. But that was kind of the process that we took in launching our apprenticeship program. And like I said today, currently we have 21 apprentices that are currently kind of in process. We have 4 that have completed, and those 4 now that have completed the apprenticeship program, and they completed just a little less than a year or so ago, they are now what we refer to as our journeymen, or our journey persons, and they now are assigned to our current apprentices, and they are the ones that are actually signing off on the competencies and also sort of mentoring them through the process, which has been great. I will say that you're not going to have that group of journey persons from the very onset, so you will have to identify a couple of staff people to kind of be those mentors or those journey persons initially. But then once you stand up the program and you have a couple of graduates or folks that have been credentialed, then those completing apprentices will become your journey persons, and then ultimately the mentors for your apprentices that are kind of coming on from there. So I will go ahead at this point and unshare.
If I may, I'd like to offer a little bit of new information about funding on the horizon. Most of you have probably heard about the Pell Grant for decades, has been awarded to eligible college students, mostly degree-seeking students. And there's been a legislation passed effective July of this year. It's called the Workforce Pell. And so short-term programming shall be eligible for Pell Grants for apprentices and students. There is, I can't promise this, but there is strong support for if a course, a community college course, is part of a registered apprenticeship program, that it is eligible for Workforce Pell. So that $300, that again, that may go away as far as a cost through this Workforce Pell. WIN, which is my organization, just got a grant to work with the community colleges, 6 of them actually in Southeast Michigan, to take their current courses that serve short-term training programs and make them one, workforce Pell eligible, and two, accessible through on-demand type learning strategies so that, again, it's more accessible for employers and their apprentices. So workforce Pell, yay, it's been in the works for years and it's finally coming to fruition.
Thanks, Jan. And thank you, Jim. That was really well done. I appreciate how step by step you made it very clear. Really impressive that you have 27, I think you said, apprentices. That's amazing. So I'm going to open it up now to questions for either Jan or Jim. And I see Debbie has her hand up.
I always have questions.
Yes, you do.
So a couple questions. You said report on progress, Jim. And so do you or whoever meets with these apprentices, do they meet with them one-on-one, or are they actually meeting with them when they're with a client to see if they are doing some of the things they're learning?
So really good question. So we do a combination. So we have a weekly kind of standing meeting between the apprentice and the journey person. And then monthly, they're going out to the sites and kind of verifying what is being discussed at those weeklies, looking to see that they are operationalizing that kind of in the community. So it is a combination of kind of weekly, one-on-one meetings to make sure that progress is kind of being made. And then they do go out to the sites monthly to sort of kind of put eyes on the participant and the staff person to make sure that what they're saying kind of in those weekly meetings is being executed out in the community.
Okay. And then when did you start doing this apprentice program? Was it like a year-ish ago, or was it quite a long time before that?
Couple years. So we're about 2 years in.
2 years? Okay.
Yeah, so still fairly new. And I will say, it was somewhat challenging initially to find those initial apprentices. For whatever reason, once we got kind of the first group through, we have found that it has just our numbers have increased dramatically. And I think it's just kind of word of mouth. I think word kind of gets out there. And now we have spokespersons. So our current completers are probably our best spokesperson. I tried to be really convincing when I went onto the news there 2 years ago. Our apprentices are way more convincing than me.
Okay. And then probably this is for Claire or maybe Janice. Well, okay. How many, is there a requirement of how many classes for this? Because that list you did. And with Claire and IMPART Alliance, you guys already have a whole bunch of work competencies and classes and everything. So I'm wondering how they integrate together. And because of MDHHS being in support of all the competencies and classes, will that be just those are my, yeah.
So Debbie, you got cut out there, your last couple sentences.
So I said, and because of MDHHS being in support of the competencies that IMPART Alliance is doing in the classes, will maybe that college course not be required because IMPART Alliance is so integrated with all of the competencies now?
So the law, okay, the law for the USDOL for registered apprenticeship requires 144 hours of what they term related trade instruction. Now, what Jim presented, he didn't present the hours, but I know it's way more than 144 hours, and he chose those to meet the needs of his workers. But law says it has to be a minimum of 144 hours. So,
Yeah, and I'll just add on to that. So Debbie, to your point, IMPART Alliance classes. Everything we're doing is, first of all, it's not asynchronous. So we have some restrictions there, but it's also not anywhere near 144 hours. And one of the things we would like to do is to enlist the help of people like Jan and Jim and you, Debbie, and others to create an apprenticeship program that includes everything that we're doing, but then enhances it enough, adds on classes enough to make it be eligible for a registered apprenticeship program. And we're really interested. I know, Jim, you've got the DSP thing going, and you mentioned, Jan, the home health aid apprenticeship program, and you and I have talked a little bit about wanting, or IMPART Alliance, we would like to see one developed that is specifically for the direct care workers, and so that it does align with the 15 competencies that the state of Michigan has adopted.
So,
Does that help, Debbie?
Does help. I think so. Me and Megan have been met with, and I think I might have told you this, Claire, but 2 or 3 times trying to figure out how to do this apprenticeship. And we're a very small company. Right now, we only have about 30 employees. Sometimes we're up to 35. But we're a small company. We couldn't afford it. Like with everything that we had to pay for and required, and with what reimbursement rates are right now, I mean, just everything. So, anyways, I'm just trying to figure out how to be able to do it because I do think it's amazing, but be able to afford to do it and not go out of business. Because, we're all right now, all agencies are probably worried about that with everything that's going on. So thank
Yeah,
you.
and no, those are great questions, and I would love to talk more with you about it. I'm sure Jan would as well. I want to give Nadine a chance to ask her question. But then maybe we could swing back because Debbie, I want to make sure I understood you correctly. I think what you might have been saying is would people that have, let's say, taken some of these IMPART Alliance classes, would they count towards the registered apprenticeship if they were an apprentice? But
yes.
we can look, okay, thank you.
Yes.
Good answer. Good answer. Okay, let's let Nadine ask her question.
I was wondering, and Jim, you kind of referred to this about the slow startup. What is the commitment required by the employer? Was that part of why it took a little bit of time to get some traction?
I think really what the slow startup, we had full buy-in. I mean, before we even reached out to, and it's a really good question, before we even reached out to Michigan Works on moving forward with an apprenticeship program, we put our kind of fiscal department, our HR department, our operations team kind of all in a room and said, hey, this is something we want to commit to. These are the different pieces that you're going to have to shift in the way that you go about your work. And I'm specifically thinking about our HR department because, previously we had that hard, 2 years of experience. And I said, hey, if we're going to go down this road, we need to lift that for this group. So, that wasn't the holdup. We had sort of alignment kind of internally to move forward. Really for us, it was, this was kind of new, this is new, and I think Janice put it quite nicely that apprenticeship programs make a lot of sense, and we all think about plumbing and electrical and pipe fitting and all of those. This is really new, so we had to do a lot of work in communicating to our community how the value of an apprenticeship track for a human service position makes sense and aligns with our values as an agency and our goals, as well as connecting that program and this track to the community in a meaningful way. So it's all about messaging, and we didn't quite know how to message it initially to get that attraction initially.
That's great. So once you got that messaging down, what was that commitment that the employer had to make for their employees to go through your programs?
So obviously the commitment to the cost of the training that I kind of outlined. The other piece that I didn't talk about was and Janice might be able to speak to this a little bit more. There is some requirements around wages at the start of the program to the end of the program. I think for ours, it's like $1.55 is the increase that they get at the end of the program. I'm pretty sure there is a requirement that we had to have it kind of in place for that standard to get the apprenticeship program ultimately approved. So we had to agree that we're going to pay people more at the end of the program.
So
Those are great
when I
questions.
write up the Appendix A with an employer for their program, what I try to do is write it up very broadly so that any employer could sign on to that. So when I looked at the competencies that Jim had on his slide, I could see writing an Appendix A. Actually, Win holds the standards, so I could see any employer signing on to the document that Jim referenced, the Appendix A. I did not write Jim's Appendix A. I don't know what my colleague put in there, but I tend to write them really broad. As far as wages, yes, the law requires that there be at least one wage increase through the duration of the program. So when I figure that out, what I do, again, because I want the standards to serve a lot of employer needs, I go to ONET and I look for what is that entry level wage for that occupation starting wage. For the state of Michigan, if I can narrow it down to a region, I do that. And that wage would be the ending wage. And then I back it up because an employer can pay more than what's in their Appendix A document, but they can't pay less. So by undershooting it and undershooting the competencies in that document, it allows for flexibility of the employer if they want to do more or pay more. So, and by the way, starting small is good because you'll learn along the way and there are some internal changes that you'll make from this process. So you can enroll, I've had employers enroll one and that's perfectly fine. So you can start as small as you want, a small, whether that is because of comfort or capacity, it's a good way to start is to start small and grow it from there.
I
I
totally
hate
agree.
to
That
I'm
was
glad
great.
we don't want from the onset.
I hate to shut this conversation down. We are at time, and I know there are a lot of
I
questions still
just ask
left.
one quick one or no?
It's up to our speakers. Can you handle? And I
Sure.
know
It's really
Nadine,
quick. Janice, is there a fee for your help at whatever you're talking about that you help with?
No, we're grant funded and so are the Michigan Works agencies. So we're at your service. That's what our mission is to help employers with their workforce needs. So no, there is no fee for us. So
good question. And I think Nadine had one quick question left too. And then I'll close our session today. While we're waiting for her to get back on, first of all, big thank you to both of you. That was extremely informative and very clearly presented. So you've answered a lot of our questions. I know I, for one, am going to be in touch with you. It sounds like Debbie might as well. So thank you very much for presenting today. And I do want to let everybody on the call know that our next Lunch and Learn is going to be February 5th. And it ties into everything we talked about today. And that is on direct care worker competencies and credentialing. So as you know, with the grant that IMPART got and the help of the State Direct Care Workforce Advisory Committee and a lot of other people, we were able to get 15 direct care worker competency guidelines adopted by the state of Michigan. And we have for the last 2 years been working on establishing credentials that align to those competencies. So you will hear all about that on February 5th at noon. So Chanel will be sending information out about that. Jim, can you provide us with your PowerPoint so that Chanel could send that out as well?
Of course.
And then we have Jan's, and then we have Jan, you said you have these frequently asked questions. So, and then Nadine's back on. So one last question.
I'm good. I got my question answered. Thank you so much.
Okay, good. All right. Well, then I will close this meeting. It was really, really helpful. I hope everybody else thought so too. And you can shoot us some questions or let us know if this was helpful for you. And I wish everybody a happy new year. We're going to keep these going and build the employer-led collaborative so that we can continue to exchange information and provide resources like this. So thank you, everybody, for being here today.
Thank you so very much. Janice, is your contact information going to be in whatever's being sent out?
It's in the FAQ, it's in the PowerPoint too. If you just scan that QR code, you'll have my digital card. So
Thank you so very much.
sure.
Great.
Have a great day, you guys.
Thanks,
Bye.
everybody.